Are you or your loved one struggling with attention deficit hyperactivity disorder, ADHD? If so, you may have heard of Guanfacine, a non-stimulant medication commonly used as a treatment for ADHD. In this comprehensive guide, we will explore Guanfacine ADHD treatment in detail, providing you with all the information you need to make an informed decision. Unlike stimulant medications, which are often the first line of treatment for ADHD, Guanfacine works differently to help manage symptoms such as inattention, impulsivity, and hyperactivity. We will delve into how Guanfacine works in the brain, its effectiveness, potential side effects, and dosage considerations. Additionally, we will discuss its possible benefits for specific age groups, including children, adolescents, and adults. It's important to note that Guanfacine is just one of many options available for treating ADHD, and it may not be suitable for everyone. By understanding the ins and outs of Guanfacine ADHD treatment, you can have more meaningful discussions with your healthcare provider and explore whether it may be the right choice for you or your loved one. Let's dive in. What is Guanfacine and how does it work? Guanfacine belongs to a class of medications known as alpha-2 adrenergic agonists. It was originally developed to treat high blood pressure but has since been found to be effective in managing ADHD symptoms. By targeting specific receptors in the brain, Guanfacine helps regulate the release of norepinephrine, a neurotransmitter that plays a role in attention and impulse control. Unlike stimulant medications like methylphenidate or amphetamine, Guanfacine does not increase the levels of dopamine in the brain. Instead, it acts on the prefrontal cortex, the part of the brain responsible for executive functions such as attention, working memory, and self-control. By enhancing the activity of this region, Guanfacine helps improve focus and reduce impulsivity and hyperactivity. Guanfacine's unique mechanism of action makes it an attractive option for individuals who cannot tolerate stimulant medications or have experienced unsatisfactory results with them. It is also commonly used in combination with stimulant medications to enhance their effectiveness. However, it's important to note that Guanfacine may not work for everyone, and individual responses can vary. Consultation with a healthcare provider is essential to determine if Guanfacine is the right treatment option for you or your loved one. Benefits of Guanfacine as a non-stimulant treatment for ADHD. Guanfacine offers several benefits as a non-stimulant treatment for ADHD. Firstly, it provides an alternative for individuals who cannot or prefer not to take stimulant medications due to concerns about side effects or potential for abuse. Stimulant medications, while effective for many, can cause insomnia, decreased appetite, and increased heart rate. Guanfacine may be a better option for those who are more sensitive to these side effects. Secondly, Guanfacine has been found to be effective in reducing ADHD symptoms, particularly in improving attention and impulse control. Studies have shown that Guanfacine can help individuals with ADHD focus better, complete tasks, and exhibit fewer impulsive behaviors. It can also be beneficial in managing symptoms of hyperactivity, although it may not be as potent as stimulant medications in this regard. Additionally, Guanfacine has shown promise in addressing specific symptoms or conditions that often co-occur with ADHD. For example, it may help reduce aggression and oppositional behavior in individuals with ADHD and conduct disorder. It has also been associated with improvements in sleep difficulties and tic symptoms, which are common in individuals with ADHD. These additional benefits make Guanfacine a versatile treatment option for those with complex ADHD presentations. Side effects and considerations when using Guanfacine for ADHD. As with any medication, Guanfacine is associated with potential side effects and considerations that need to be taken into account. Common side effects of Guanfacine include drowsiness, fatigue, dry mouth, and dizziness. These side effects are usually mild and tend to improve over time as the body adjusts to the medication. However, if these side effects persist or worsen, it is important to consult with your healthcare provider. In rare cases, Guanfacine can cause more serious side effects such as low blood pressure, slow heart rate, or liver problems. It is important to monitor blood pressure and heart rate regularly while taking Guanfacine, especially during the initial titration period. Liver function tests may also be recommended to ensure the medication is not causing any adverse effects. Another consideration when using Guanfacine is the potential for rebound hypertension or a sudden increase in blood pressure if the medication is stopped abruptly. It is important to work closely with your healthcare provider when discontinuing Guanfacine to gradually taper the dosage and minimize the risk of rebound effects. Guanfacine may also interact with other medications, so it is crucial to inform your healthcare provider about all the medications, supplements, and herbal products you are taking. Certain medications, particularly those that also target blood pressure, may interact with guanfacine and lead to adverse effects. Comparison of guanfacine with other non-stimulant treatment options for ADHD. When considering non-stimulant treatment options for ADHD, guanfacine is not the only medication available. Another commonly prescribed non-stimulant medication is atomoxetine, which also works by increasing norepinephrine levels in the brain. Both guanfacine and atomoxetine have been shown to be effective in managing ADHD symptoms, but they have some differences in terms of mechanism of action and side effect profiles. Guanfacine primarily targets alpha-2 adrenergic receptors in the prefrontal cortex, while atomoxetine inhibits the reuptake of norepinephrine throughout the brain. This difference in mechanism of action may contribute to variations in side effects. For example, atomoxetine has been associated with an increased risk of suicidal thoughts in some individuals, particularly adolescents and young adults. Guanfacine, on the other hand, is generally considered to have a more favorable side effect profile. It is important to discuss the pros and cons of both guanfacine and atomoxetine with your healthcare provider to determine which medication may be the best fit for you or your loved one's specific needs. Factors such as individual response, tolerance to side effects, and any comorbid conditions should be taken into consideration when making a decision. How to use guanfacine effectively for ADHD management. To use guanfacine effectively for ADHD management, it is important to follow the recommended guidelines and work closely with your healthcare provider. Guanfacine is usually initiated at a low dose and gradually titrated upwards to find the optimal dosage that provides symptom relief without causing significant side effects. This titration process allows the body to adjust to the medication and minimizes the risk of adverse reactions. It is important to be patient when starting guanfacine, as it can take several weeks to see the full effects. Some individuals may notice improvements in symptoms within the first few days, while others may require several weeks of treatment to experience the benefits. Regular communication with your healthcare provider is essential to monitor progress and make any necessary adjustments to the dosage or treatment plan. In addition to medication, behavioral interventions and therapy can also play a crucial role in managing ADHD symptoms. Guanfacine should be used as part of a comprehensive treatment approach that includes behavioral strategies, such as organization techniques, time management skills, and parent or teacher training. These non-pharmacological interventions, when combined with medication, can enhance overall outcomes and improve daily functioning. Guanfacine dosage and administration guidelines. The dosage of guanfacine can vary depending on the individual and the severity of their ADHD symptoms. Typically, guanfacine is started at a low dose, such as 1 mg per day, and increased gradually as needed. The maximum recommended daily dose for guanfacine is 4 mg for children and 7 mg for adults. However, the appropriate dosage should be determined by a healthcare provider based on individual needs and response to the medication. It is important to take guanfacine as prescribed and at the same time each day to maintain consistent blood levels of the medication. Guanfacine can be taken with or without food, whichever is preferred, but it is important to be consistent with the chosen administration method. If a dose is missed, it should be taken as soon as remembered, unless it is close to the time for the next scheduled dose. Double dosing should be avoided. Frequently asked questions about guanfacine for ADHD. Is guanfacine addictive? No, guanfacine is not considered addictive. It does not produce a sense of euphoria or dependence like stimulant medications can. However, it is important to follow the prescribed dosage and not abruptly stop the medication without consulting your healthcare provider. Can guanfacine be used in combination with stimulant medications? Yes, guanfacine is often used in combination with stimulant medications to enhance their effects. This combination therapy may be particularly beneficial for individuals who have not achieved optimal symptom control with stimulant medication alone. Can guanfacine be used for adults with ADHD? Yes, guanfacine can be used in adults with ADHD. Its effectiveness and side effect profile are similar to those observed in children and adolescents. However, the dosage may differ depending on the individual's needs. How long does it take for guanfacine to start working? Guanfacine can take several weeks to start working, and the full effects may not be seen until after several months of treatment. It is important to be patient and consistent with the medication to allow for optimal results. Can guanfacine be used as needed or only on a daily basis? Guanfacine is typically taken on a daily basis to maintain consistent blood levels of the medication. It is not typically used on an as-needed basis like some other medications. However, The dosage and administration should be determined by a healthcare provider based on individual needs. Success stories and testimonials from individuals using Guanfacine for ADHD. I have been taking Guanfacine for my ADHD for several months now, and it has made a significant difference in my ability to focus and stay organized. The medication has helped me feel more in control of my thoughts and impulses, and I have noticed improvements in my work productivity and overall daily functioning. I have not experienced any significant side effects, and I am grateful for the positive impact Guanfacine has had on my life. My son has been taking Guanfacine for his ADHD for a year now, and it has been a game changer for him. Prior to starting Guanfacine, he struggled with impulsivity and had difficulty staying on task at school. Since starting the medication, his teachers have noticed a remarkable improvement in his ability to concentrate and follow instructions. He is less impulsive and more engaged in his learning. Guanfacine has truly made a difference in his academic success and overall well-being. Please note that individual experiences with Guanfacine may vary, and it is important to consult with your healthcare provider to determine if it is the right treatment option for you or your loved one's specific needs. Potential drawbacks and limitations of Guanfacine as an ADHD treatment option. While Guanfacine can be an effective treatment option for many individuals with ADHD, it is not without its drawbacks and limitations. One limitation is its variable response rate, as not everyone will experience the same level of symptom improvement. Some individuals may find Guanfacine to be less effective compared to stimulant medications or other non-stimulant options. Another drawback is the potential for side effects, although they are generally mild and well tolerated. Drowsiness and fatigue are common side effects that may interfere with daily activities, particularly during the initial adjustment period. Dry mouth and dizziness are also reported side effects that may be bothersome for some individuals. Additionally, Guanfacine may not be suitable for everyone with ADHD. Certain medical conditions or medications may interact with Guanfacine, making it less appropriate or potentially unsafe. It is important to disclose all relevant medical information to your healthcare provider to ensure Guanfacine is a safe and appropriate treatment option. Finally, Guanfacine is not a cure for ADHD. It helps manage symptoms and improve daily functioning, but it does not address the underlying causes of ADHD. It is important to combine medication with behavioral interventions and therapy to optimize outcomes and develop long-term strategies for managing ADHD. Conclusion: is Guanfacine right for you or your child's ADHD treatment? Guanfacine can be a valuable non-stimulant treatment option for individuals with ADHD, offering benefits such as improved attention, impulse control, and additional symptom management. It provides an alternative for those who cannot tolerate or prefer not to take stimulant medications. However, like any medication, Guanfacine has potential side effects and considerations that need to be taken into account. It is important to have open and honest discussions with your healthcare provider to determine if Guanfacine is the right treatment option for you or your loved one's specific needs. Considerations such as individual response, side effect profiles, and the presence of any comorbid conditions should be taken into consideration. Additionally, behavioral interventions and therapy should be included as part of a comprehensive treatment approach. Remember, Guanfacine is just one of many options available for managing ADHD, and what works for one person may not work for another. By arming yourself with knowledge and working closely with your healthcare provider, you can make informed decisions about ADHD treatment and find the best approach to support you or your loved one's well-being and success. Thanks for watching.